All this is Dr. Mobeen Sayed from drbean.com. Welcome to one more show. So, the discussion today is about the pathology and the progression of the Omicron caused disease, although less severe, but still, how does that happen? So, I'm going to present two set of topics. One is the studies that we have already seen that tell us about the change pathology. So, I'll just remind you of what those are. And then we would look at a hospital's reporting of the patients that are arriving in the hospital and what kind of symptoms do they have. So let's start our discussion. So these are references. This is drbean.com. Here is the hospital. This is the same hospital. This is the Houston Methodist Hospital chain and the data from them. This is the same hospital that was in the news a few days ago for suspending Dr. Mary Bowden for her using IVM, and they were upset about her tweets as well. So yes, it's that hospital. However, this data is interesting, so I'm going to just look at the data. This is also an interesting article. What they have done here, why this is interesting, is that they have picked up all the pathology or mechanism changes that have appeared because of mutations in Omicron, and they put them in one place. So they did a good job. So keep this in mind as well, and let's now start our discussion. So how does it kill if it is less severe? That is a basic question. Or what is the progression of the disease? And then how about the vaccine breakthroughs? So let's see, I have no disclosures. This is one of my older paintings that is still hanging out there in this presentation. This is the Omicron. Medical disclaimer, this is not a medical advice. And here is what we'll review. Pathology so far, I would not review every single concept of it, just reminding us, and then the hospital data. So here is a pathology. We know that the Hong Kong study, or the studies from Hong Kong, showed us a couple of pathology changes. One was that, and this was in vitro, that Omicron was able to infect the larger airways, you can say rather upper airways. The larger airways do go into the lower parts of the lungs as well, but still they are not the lungs tissue and they're not deeper airways. So larger airways is where the infection occurs 70 times faster than the other parts of the virus tissue, plus 70 times faster than the other variants, for example, Delta. So that is one reason. Second reason is that there is actually a multiple folds reduction in the infectability or infectiousness of the virus for the lung tissue. So not only it is more sticky and able to do more work in the upper respiratory tract, it is actually less able to do more pathology in the lower respiratory tracts or lungs. Then we are also aware that there is a preferential change for the entry. So this virus can now, the Omicron, can enter a cell without really the need for TMPRSS2. So it can use that as well. So that is ACE2 and TMPRSS2. That was similar to Delta, but this virus can enter a cell through endosomal activity as well. And that is an alternative route, which has a little bit of a reduction in severity. And then we also know from Gupta labs that they found out that this virus does not cause fusion of the cells in the lower respiratory tracts as much as the previous variants were able to do. So it causes less chaos in the lung tissue, resulting in less immune responses. So there is less damage, there is less immune response. So overall, the severity is less. Now, here is a big question. We know this, and we keep saying that it is less virulent, it is less severe. Some articles, some scientists say, no, it is not less severe, it is just the vaccines, it is the people already infected and recovered, and so on. So there are all kinds of messages out there. I am using the message that it is less virulent, and I have the studies and data to show for that. So the question is, if it is less virulent, what is the disease it causes which cause people to die? So the basic answer to that is, number one, let's put that in context. The deaths in this Houston Methodist hospital chain, so I'm using one hospital and their reported deaths. We can look at other data as well. They are reporting 0.9% deaths in Omicron infected patients that are admitted to hospital, compared to, in the same chain, previously the Delta variants and previous variants, their death rate was 5.3%. So almost 5 times less death rate. Now, once again, we can sit down and we can say this is Omicron, one part, vaccines, let's say another part, previous infection, another part, the younger community, another part, and so on. So there are many, many factors. If we talk about vaccines efficacy, then I think we have to also talk about vaccines breakthrough, vaccines lack of efficacy. And I have that data here as well. That is very interesting. 53% of the infected, triple dose infected patients versus 6 or 7% with Delta. So vaccine efficacy will have to be looked at both from protection and from breakthrough. In there, the good news is that it seems like protection from death is there. However, Omicron can evade or escape the vaccines better. So this is the basic context. This is what we are looking at, 0.9% versus 5.3%. Then the question is, what is the pathology? So the pathology is still the same, and that is lung tissue damage, immune system response with cytokine storm, because that is still happening with the spike protein, and the vulnerability is very similar: obesity, diabetes, and so on. The difference is that progression of the disease to a severe form with a severe outcome of death is less. So that means, and the vascular issues and the clotting issues are there as well, just less in severity and less in number. So that is the basic shape of the current situation. So now let's see what happens. What is the data we're going to see? The data shows that the respiratory disease and vascular disease is still there, and majority of the patients, if they excuse me, if they end up in the hospital, they still are mostly managed on room air or low flow oxygen, compared to the previous variants where patients would progress towards high flow oxygen or invasive ventilation or ECMO or death. So that means lower respiratory tract are still getting involved in some people. That means cytokine storms are still happening in some people. The only fortunate thing is lesser. And because of this disease progression, there are some researchers say, well, it is not the virus that is lesser, it is people who are more vaccinated. And then some researchers show that the virus itself is less virulent as well. So I think it's a combination of all of the things. Virus less virulent, vaccines waning as well has an effect, a negative effect. Previous infection, and then masking and younger age and so on. Now, summary of the findings. Before we look at the data, what is the summary? If you said, just tell me what are the differences, here are the differences. This is Omicron versus Deltas and Alphas. And this is Houston Methodist Hospital. They started using Omicron data, or they started having the very first case of Omicron was on 27th of November 2021. So from there onwards, they started sequencing with Omicron to see Omicron. Previous ones were Delta, and Alpha. And here's what they saw: significantly lesser deaths in Omicron patients, 0.9% versus 5.3 or 5.4. More youngsters infected. And they say, I call it carelessness. They said because of their social interaction, their social behavior, they are more going outside, meeting each other, going to schools, and so on. So, more younger individuals. Interestingly, more females than males. It used to be more males than females in the previous variants, and now more females than males. Significantly fewer patients coming to the hospital, and that is a huge difference. 20% or 19.8% of the Omicron patients are admitted to the hospital versus 54.6% admitted to the hospital. So let's say these patients come in, 100 patients of both variants, they arrive in the hospital. Out of 100 patients with Omicron, 20% will get admitted. Out of 100 patients with Delta or Alphas, 54.6% will be admitted to the hospital. The disease is still going to be the same: vascular, respiratory, clotting, cytokine storm. Length of stay in the hospital is shorter. Now, length of stay is shorter. The progression of the disease and the support needed in the hospital is also less. So, significantly less need for maximum respiratory support. And as I showed here, what is the respiratory support? Somebody being there on the room air, maybe occasional shortness of breath starting to get managed, or low flow oxygen requirement, or high flow oxygen requirement, or non-invasive ventilation. Non-invasive ventilation is where they are giving oxygen and the air with pressure, but they're using still the upper respiratory area. That means they're giving it through the mask or through the nasal route, but not bypassing the upper area and going down. So if they bypass the upper respiratory area and directly go below in the larynx, in the trachea, then that would become invasive ventilation. So non-invasive ventilation, invasive ventilation, in some cases ECMO, and then unfortunately death. And of course, all of these pathways have an exit as well. So they're saying that with Omicron, lesser people progress to more severer forms. Significantly higher vaccine breakthrough. That is the interesting part. So 55.9% vaccinated versus meaning cases are vaccinated versus 3.2% with the previous variants. Now there are going to be many explanations for those. For example, number one, yes, Omicron does escape vaccines. Number two, yes, vaccination amounts were less before. Number three, the boosters are more recently given compared to before, and so on. So there are multiple reasons, but vaccine escape is a reality. Vaccine effectivity waning is a reality. And we are seeing that. I mean, vaccine companies themselves are now saying that, hey, two doses don't work. So they have seen significant breakthroughs. And I have put there somewhere in these areas, I've put their notes as well. So, for example, here they're saying, as noted above, and I'll show you that on their site as well, as noted above, ample in vitro and animal infection model data have accumulated, suggesting that Omicron is less virulent than Delta or Alpha variants of concern. So, vaccine breakthrough. And again, please realize vaccine breakthrough because there is vaccine breakthrough, because the variant is able to escape the vaccine. That's one. Then vaccine breakthrough because there are more cases of the vaccine compared to not vaccinated. Then there is waning of the antibodies and there is a area of immune system rest, that if somebody gets infected during that time, they would have an infection or symptoms. With all those kind of explanations, this is a reality. 55.9% breakthrough with Omicron, 3.2% with Alpha, and Delta was 24.3%. That was the breakthrough. So I have that over here, 55.9% compared to 3.2 and 24.3 for Alpha and Delta variants of concerns. That is the breakthrough. Hospitals comment. So I'm trying to keep this as less of Mubin's opinion part and more of the data so that we can see what is happening. You can form an opinion. We can plan to discuss that in an opinion session separately. Here I want to present the data. Hospitals comment. So this is also from the site. Several questions arise from our findings, namely the underlying causes for the differences we observe in Omicron compared to Alpha and Delta patients. Increased vaccine breakthrough cases may be due to serologic and structural differences in Omicron relative to Alpha and Delta. It is also possible that waning of immunity is a contributing factor as well. We do not currently have serologic or other data that could address this possibility in our patients. As noted above, ample in vitro and animal infection model data have accumulated, suggesting that Omicron is less virulent. We speculate, so this is the speculation, that the lower age of Omicron patients may be attributable to disproportionately greater likelihood of risky behaviors. That's what I said in the beginning, careless behavior, in the younger population. For example, less mask wearing and less social distancing. Regardless, additional studies are required to gain more information about factors contributing to the differences between Alpha, Delta, and Omicron patients that we identified in this study. So now we are at the end of the presentation I did. Let's very quickly look at the data. There are some very interesting parts in the data. So this is it. If you just wanted to hear what are the results, these are the results. Now I'm going to show you the data. This is more of a detail dive now. So look at this. This is the first table. They have two tables here. They separated the data collection in two time windows, and so they have two separate tables. This is table 1. This has 7,617 unique patients. In the table 2, they have 20,196 unique patients. The only difference between the tables in terms of data is that at the end of the first table, there is just fully vaccinated or not. And at the end of the second table, they have fully vaccinated or not, 7 days past the first vaccine, 14 days past the second vaccine, 14 days past the third vaccine, and their data. So I'm going to now make it bigger so we can see it. And hope I can present it now. So there is some part of the columns that are going to be truncated, but let's see. So Omicron is the second column, Alpha is the third column, total is the fourth column, and then p-values is the last column. So remember, Omicron is the second one. So check this out. Median age, 44.3 versus 50. So younger, 7 years younger, median age. Female, or the gender, female 57.8% with Omicron and 51.3% with Delta. Males 42.2% with Omicron versus 48.7% with Delta. So Delta was causing more infections in males versus Omicron. And Omicron is causing more infections in female versus Delta. Ethnicity. Now, please remember, ethnicity cannot show the preference of the virus yet, unless we know the exact composition of the society's ethnicity as well. For example, let's say in one society, everyone who lives there is Caucasian. then of course the remaining ethnicity numbers will be zero, but that doesn't mean the virus does not infect them. It's just that they are less in number or they're absent. So ethnicity data should be looked at by overlapping the population's composition. So that means it is interesting to look at, but without population numbers, it's kind of not in context. Caucasians, Omicron causes 36.4%, Delta used to cause 39.4%, slightly more. Hispanics or Latinos, 22.2% Omicron infections and 29.9% with Delta. Black, 30.8%. So Omicron is more infecting blacks compared to blacks infected by Delta. So 23.2% with Delta. Asians, 4.5% with Omicron versus 3.9% with Delta. So slightly more by Omicron. Other, 29% versus 32, and 0.6% versus 1.0. Unavailable, 5.4 versus 2.7. And that reminds me, yesterday when I was talking about the most important lecture, the prevalence of the long COVID, I read that sentence incorrectly, and I gave incorrect number for North Americas. It was 30%. I ended up saying 40 or 50%. That is the downside of live lectures. You cannot edit them and create, clear them and fix them and then upload them. They are what I'm saying. Okay, so BMI, that is interesting. Look, BMI, not much difference. Admission data, people who are admitted, Omicron, 19.8% of all the cases that they had, 19.8% got admitted, versus of all the Delta and Alpha cases they had, 54.6% got admitted. Of course, patient had some problem that they were there at the hospital, and then there is a chance that they would get admitted as well. For example, not here, but in a different country, one of my friends, she went to the hospital complaining of shortness of breath, and she thought, I'll go there, they'll give me some medicine, I'll come back. But when I went there, they admitted me right then and there. So admission, 19.8% versus 54.6%. Length of stay at the hospital, 3.2 days. So this is for the discharged, those who went back. 3.2 versus 5.1. Now this is the maximum respiratory support. So to read this, read from bottom upwards. So start from the bottom part of this section, and that is room air. Then a little more aggravated, low oxygen. Then a little more high oxygen. Then little more non-invasive ventilation. Then more mechanical ventilation or invasive, and then even more ECMO, and then even more will be death. So if I start from here, and my apologies, Luffy is he wants to go out, he cannot go out, so this is his life at this time and ours. So we'll we'll listen to the songs of his people. Okay, so room air, patient who came to hospital can still breathe, maybe with some difficulty, but at the room air, maybe their saturation is fine, but they still have some symptoms. So 43.6% of the patients with Omicron, room air, versus 18.6% with Delta. So here the lower number is actually not good. Higher number is good, that more people in the hospital were okay at the room air. Low flow oxygen, so 2 liters, 3 liter oxygen, 35.5% Omicron, Delta 42. So Delta was actually better. High flow oxygen, 8.1% versus 21.2%. Sorry, so low flow oxygen, Delta 42% required it. So that was better. Here, high flow oxygen, 21.2% required it. That is bad compared to 8.1%. So if you see now, the severity is reducing. that it is not becoming that invasive. Then ventilation, non-invasive, 7.1% needed ventilation versus 9.5 with Delta. Mechanical ventilation, 5.5% versus 8.4 with Delta. And then ECMO, 0.1% versus 0.4. And if you go all the way to then a sad outcome, and that is the death, then you would see mortality is 0.9% versus 5.4%. So even if the patient ended up in the hospital, they still have a better chance of coming out of the hospital compared to Delta. Now, once again, I keep repeating, in this article, they have various kind of thoughts that this may be vaccines, this may be younger age, this may be previous infection. Actually, they don't use a previous infection. They should. That is my part. And then uh, other factors may be there, the virus itself being less virulent. This is also interesting, the PCR cycle, which tells you the virus load. So PCR cycle, they have a couple of types here. Abbott's type, if they use, in the case of Delta, 22.4 cycles were needed to detect it. In the case of Omicron, 20. So that means it created more load, and a smaller number of cycles could quickly figure it out. With the hologic, once again, they are 24.2 versus 22.7. So the takeaway would be Omicron replicated faster than Delta. Vaccines, check this out. Vaccines, fully vaccinated. And this would be, once again, just like I'm looking at a hospital's data, which in my personal preference, I'm not a big fan of them because of how they behaved with that doctor. Similarly, the data here, we should look at it in both ways. I have had some journalists speaking with me who wanted to, or who are thinking that maybe this is because the more vaccinated you get, the more infected you get. But there is also this possibility that there are more vaccinated people and the breakthrough is occurring, so they would get infected. So, for example, if a society is just all 100% vaccinated, then any infection will be 100% vaccinated. And as the percentages change, this is why there are two things that I really wish the data presenters will present. One of those is exact mortality rates with vaccination, and number two is the comorbidities and vaccination and age part. For example, yesterday Alberta's data that had a lot more information compared to the information here, but anyways, still this information is good as well. So fully vaccinated, Omicron 55.9%, Delta or Alpha 3.2%. Now you could also say, once again, there were just less people vaccinated at that time, but there is more escape by Omicron as well. So that is a reality as well. We cannot just simply say it is the size of the cohort. So 3.2% with Delta and Alpha, 55.9% with Omicron. This is the second table. So this is another sampling of the patients, and this was 20,196. Very similar results, but there is an additional part or set of data that is interesting to see here. This is once again vaccine results, and I hope it is all readable. There is a link as well, so you can open that up. So first of all, the no vaccine, Omicron patients that did not have vaccine, 40.6% of all the patients. Delta or Alpha that didn't have vaccine and were infected, 72.6%. 7 days past first vaccine, I just left it. That's less useful. 14 days past second vaccine, that is in many cases the fully vaccinated's definition. 40% in Omicron's case, 23.4% Alpha and Delta. So there is more breakthrough, and we are seeing that. Then 40% passed third vaccine, 14 days past the third vaccine. 15.9% versus 0.9%. Again, this could be because in Delta and Alpha time, there was not enough people with third dose. So imagine if in that time there was nobody with third dose, then that would be zero. So that is very interesting as well. But if you take this data, and I'm seeing this a lot, and this is why I wanted to discuss this here with the cool beans, because we always try to figure out what are the data points what are their contexts. If you take this data, the way I'm seeing folks to articulate this is they say the more there are doses, the more there is infectivity. The second thing compared to deltas. And the second thing that they say, that they do not say, is that the death rate, even with the more infectivity and the escapes and the virus bringing them to hospital or not, you're seeing severity is less. So death rate is 0.9%. So then this is the other narrative, which says if you are vaccinated, then the risk is 0.9%. Although in this narrative, the youngster, the younger age, the previous infection, us learning how to live and protect ourselves in last couple of years, these are all social distancing, masks, hand washing, people just hanging out in homes nowadays more. There are many factors. So there cannot be just one factor that becomes negative or becomes positive. So some folks pick up this part and run with it, and some folks pick up this part and run with it. I think the truth actually is somewhere in the middle. So this is the data points. There are some interesting uh, descriptions as well. For example, they say over here, we next analyzed Omicron vaccine breakthrough cases, 2,497 of the 4,468 total Omicron patients, 55.9%, for whom we have whole genomic sequence. There was, check this out, there was no simple relationship between the time elapsed since administration of the second vaccination dose and the data of vaccination breakthrough. I think that there would be a relationship when it is after 4 months. But, anyways, their observation is there is no such relationship. So maybe their data does not show it. The next thing is interesting here. The next we analyzed, I put the word we in here, individuals with breakthrough cases after receiving a third dose of either Pfizer or Moderna. We found that 15.9% of the 4,468 Omicron patients met this criteria, consistent with Omicron causing a significantly increased number of vaccine breakthrough cases. Many studies have reported that this variant has reduced sensitivity to antibody neutralization in vitro, and they have given the studies here. Look at the number of studies. Likely in large part due to the extensive number of amino acid and other structural changes. So we kind of are aware of the changes. So that is the discussion. I'm going to stop here, and I'll come back in a few minutes. What happened here? Texas is saying, DDS, I deem you a bot. Now go. What's going on? Don't do that. Okay. So John Snyder says we miss France. Yes, we do. But France decided not to be here, so that's her choice. Gold Country says, this is making me drowsy. I'm easily bored. Gold Country, go to sleep. I wanted to make sure that data, so first 19 minutes are sufficient, and then the deeper dive is there. Now let's just see. I don't want to go further. It's 6:36. I'll come back and we'll discuss one more thing. So let's meet in a few minutes. So please do me a favor, like, subscribe, and share. If you have questions, hold on to them. I'll discuss them next. And if you wanted to support this work, there are links in the description. You can buy me a coffee, or you can become a patron, or you can